we're not a scientific group here. Let me ask you what recommendation you think that our committee would be able to make based on the science that exists on this issue. Or should our recommendation be perhaps that more study is needed?
So our group, the Kuhnisen Foundation, has made our recommendation to the Canadian government very, very clear. And we do represent Canadian veterans and Canadian constituents. In a press release published September 19th, 2018, we called on Veterans Affairs Canada to screen recent Canadian veterans for symptomatic mefloquine exposure. That is our recommendation. That is the single most effective thing we think can be done to improve the situation of Canadian mefloquine veterans. By implementing screening for symptomatic mefloquine exposure systematically, meaning as a result of some directive from the Minister of Veterans Affairs or some decision at VAC. This would serve as a tacit acknowledgement that the government recognizes this as a problem, and it would permit clinicians to begin to identify those who may be suffering disability from this condition.
There's always more studies that can be done. People can set up a registry that's been done in other settings, but I wouldn't want the need for more studies to delay the public education that you were talking about earlier.